Okay, hey guys, this is Dr. Charity Stanley, and I am here with a couple of my friends that have experienced the challenges of being a new nurse. So I'm going to let them introduce themselves and tell us a little bit about where they work. Go ahead, guys.
I'm Tiffany Coward. I am an operating room circulator at a level 1 trauma center.
I'm Jodie Blume and I work in med-surg.
Excellent. So you guys have experienced the challenges of graduating nursing school and taking the NCLEX. Kind of give us some idea about what it was like for you taking the NCLEX. How long did it take for you to get your authorization to test? And how did you face those challenges?
So the APP came, or ATT, came what? We were supposed to get it within 8 weeks, is that right? And I got it 8 weeks to the day. So it was very nerve-wracking. Very nerve-wracking. What about you, Jodie? You got it a little bit before I did.
Just very slightly, yes. I don't know that we were told in our little meeting that it was going to come much earlier than the 8 weeks. But through some phone calls, we discovered that it was going to take a while. So I don't believe we got ours till like the first week in July, maybe.
That sounds about right, because I started my job the week after I tested. So yeah, that's right.
So after you got your ATT finally, how long did it take for you to actually be able to sit and test?
I set it up for the next week, but I had to travel outside of the area to do so.
Yeah, mine was able to set up pretty quickly. It was within a couple weeks time to set it up. Yeah. We had that opportunity to study during those 8 weeks, so a lot of us were just really geared to get going and take it.
It usually takes about 8 weeks, and there's only a couple of people at the state level that actually work on specifically that kind of thing. And if you think about the number of students throughout the state that are graduating at the same time, they have a lot of stuff to do.
Yeah.
So it's how did you deal with the nerves of sitting down and taking the NCLEX? How did you keep your cool?
We didn't. We didn't. There was a lot of tears involved in studying, and it was nerve-wracking for sure.
Luckily for me, when I actually sat for the test the night before, I naturally was just one big ball of nerves, but through prayer and some answered prayers, when I went to take that test, I was as calm as I could be. I was level-headed. I was able to tell myself that they are not trying to trick me. There are going to be questions that we are just not going to be able to answer, and that's not going to make us fail. And I was able to stay very level-headed through that,
Very good. So
we both had a great support system. I know that I had a wonderful phone call with a great friend of mine right before I tested, and I was fairly calm once I went. I mean, you have to be, because it's going to happen regardless. So
what did you do while you were waiting for the result? How'd you keep your sanity during that time?
I didn't. I will tell you, because I was about an hour and a half from home, and I left there, and my dad called me, a couple other people called me, and I was just like, guys, I can't talk to you right now. And so I just couldn't. I didn't want to talk. I was just a wreck. You go through all of nursing school and you're stressed out, and it's like you finish that NCLEX and you automatically think that you failed, because I got all 145 questions, and I left there and it's like, it's over. I don't know if I fail, I know I can test again, but even at that, like, I went through all this for 4 years and it's over, and I don't know what to do with myself. I don't know what the future looks like. And I don't really know how to explain all the feelings, but I remember I made it about halfway home, and I pulled over by a lake that I had to drive by to get home. And I sat there for 2 hours and bawled my eyes out. I wasn't sad. I can't tell you the feelings I had. I was depleted. And all I knew to do was cry. So I sat there at the river and I cried for 2 straight hours. But I went home and I did the little test thing to see if I maybe passed, if they say that test works. And according to that, I did, but I didn't believe it. So you don't get the results till like 2 days later, I think. And I did pass, thankfully.
Well, congratulations. What was
Yeah.
it like for you, Jodie?
On the opposite end of the spectrum, I only had 75 questions. I was still very, very calm. It did not upset me, but I looked at the screen when it just automatically popped off and said I was done, that I had failed. There was no, I did so bad that it stopped me at 75 questions and I was out of there. I had my husband drive me, who never, ever, ever takes off work, but I asked him, please take off work and drive me, because I just know that when I'm done, I'm going to feel like she just described, what do I do now? This all built up to this moment of years and years of a buildup. And so he did, and he sat there. He went off while I tested, but he came back pretty early. I was the last one out of there. Actually, I took so long to take it. And he watched everybody walk out of there crying. And I was not crying. I was still in this very, very calm state. I just think the prayers were definitely working. And there was a fellow student waiting to go in with the next group, and she stopped me, and I was able to hold composure and tell her, you've got this, Roan, stay prepared as well. And I feel like they did. I was not fibbing. You're going to do just fine. There was nothing there that I've never heard of before. The answers in those answers. There's an answer that's correct. You just got to match it to the question properly. You'll do just fine. And then I got in the car, and my husband said, well, where do you want to go? And I said, well, I've got my email saying I can that means that you can try and pay for it again. And that's this little trick that they can see to see pass. And I said, I already got my email. So let's go to a Starbucks. He says, well, where do we need to go? And I knew exactly where we were. I've been in that area many, many, many times. But in that moment, I had no idea where we were. That's the confusion that came over me. It was a feeling I'll never forget. I had no idea we were in Tennessee. I mean, it really took the life out of me. And so he had to figure everything out. And, I brought my laptop and was able to do that trick. And my results came pretty quick. I don't know if it was like a day or two. Yes.
Very good. So how did you decide what area you wanted to work in?
Jodie, I'll let you go first.
Well, I had already worked on my floor for quite some time, about 4 years as med surg, and I felt very comfortable there. And I liked what appealed to me about med surg was there's always something new or different going on. A patient that's going to have an illness that you're going to learn something new. It's a constant learning. I don't like being mundane, and I enjoy that. And I still, to that day, that's what I enjoy. I'm a constant learner. I love to look things up and come home and research it. I write little notes down of something that I'm not familiar with. And so it's every day there's something new to learn, and I really enjoy that.
Absolutely. Tiffany, what about you?
So I did my preceptorship in the operating room, and I loved it. I absolutely loved it. What I love about the operating room is that it doesn't matter what initials are behind your name. Everybody's important. It's not like it is on the floor where, doctors think they're, way up here and you're way down here. And it's not like that in the operating room. A lot of times you're calling doctors by their first names. It's just a completely different environment, and I love it. It's all no matter who you are, you're all a team working together for that one patient. And I just love it.
So, what were some of the challenges of stepping out of nursing school and going straight into an operating room environment? We always hear that you need to have med surg experience first. So, I'm just kind of curious what that was like for you stepping out and going into such a specialized area.
For me, it was pretty easy, which granted, I am a new grad, but I have 17 years in healthcare. So I guess maybe asking me that question's not the same as asking, somebody in their early 20s. But, and I worked on the med surg floor through nursing school as a tech. So I had that with me too. And of course, they knew that I was in nursing school. So they kind of showed me and guided me to different things while I was there as a tech. So, I wasn't an RN on a med surg floor, but I dabbled in, what needed to be done there. So, but going into the operating room, it is completely different. The things that I learned in nursing school, I don't really need. Yeah, I don't know.
So, what was your training like?
In the operating room, so at the hospital that I work at, it is actually it's about 9-month long perioperative program. So you go through 3 weeks in the classroom, just learning all there is to learn, like book wise. It's like being right back in school, learning the procedures, the instruments, just, the ins and outs, how to properly gown, sterile fields, all those things. So 3 weeks of that, and then you are put into a 6-week preceptorship with one particular nurse in whichever service line. So I was in 6 weeks of urology and learning all that. Then from there, we go through 2 weeks of the other service lines just to kind of get a general idea of how every different kind of surgery works. Then at the end of that, then that's with a preceptor as well. At the end of that, then you're on your own going back through the service lines again for 2 weeks at a time. And then at the end of that, then I got offered my position, which I'm a ear, nose, throat, and plastic circulator. So, but it's a long process, and there's not very many places that offer the perioperative program in America. So I have worked with people who have moved here from California, from New York, New Jersey, because they researched this program and they came here specifically for this.
Really?
Mhm.
Excellent. So, tell me what your experiences were like, Jodie.
Well, like Tiffany, not having near as much experience as Tiffany, but having that much time on the floor that I chose to work as an RN on, I thought that was going to really help me. Come to find out, I still had so many experiences in my year. Because like I said before, every patient has a different need. They can be very minimal to very extensive needs. And you're having that patient all day long. And a lot of course, your patients are going to be elderly. So in the middle of something you're doing, they'll put their finger up, I got to use the restroom. And you know that you're stopping for that, or somebody down the hall is jumping out of a bed, or somebody else is not breathing well. So there's all this decision making that you got, do I stop what I'm doing, run to this, go to this, what needs to be given now? I've been doing this for almost a year, and just last week, I answered my first NG tube because it's not that often. So we learned it in school, but this was in a lab class a year and a half ago, So I give blood every now and then. So every time it comes up again, I have to stop my brain for just a moment and say, okay, what are the requirements and the protocol for all this? Giving blood, you have to go find out where in the computer to print something out. It's not something you do every day. So memory is a key, having a good memory because you're not going to do the same things every day all the time. So my training experience was with a nurse that just retired. So she had 30-something years. She taught me so much. I was very, very, very lucky. But in the same breath, it was hit the ground running. I mean, she was charge nurse. We had a full load, sometimes 12 or 13 patients. And her being charge nurse with a floor that's full, it was really hard to get the orientation in your brain you think you're going to get.
So I know when I was working on the floor, I would always have, like, for the skills I didn't do a whole lot, like giving blood or what to do when a patient dies, I would always have cheat sheets within my binder. So have you found that to be a good way?
Yes, I do keep these little like heparin drip protocols. If they have low magnesium, low potassium, I keep all that, stuff printed, and I took screenshots of my learning of the blood, so I have it in a special file. So at this point now, I've done it enough, but there were times where I'd refer back to exactly, so I kind of had a quick glance, and that was my cheat sheet of looking at that. Yeah. Definite
Absolutely.
cheat sheets.
So how do you stay organized as a new nurse?
It takes time. That's something I really have big advice for everybody is don't beat yourself up. Ask a lot of questions. And coming for somebody that's in her 50s and being a nurse for the first time, I think people look at you with different, just visually look at you, your age, your maturity, with different expectations. But I'm still that new nurse. I'm still like the 25-year-old, 23-year-old new nurse. I still have confusions, questions. What would you do? How would you handle this? How would you word this to the doctor? How do you interpret what the doctor just said? I still go to people and ask. It's very, very important. And as far as organizing my day, it's changed from month to month. I finally come down to a system that works best for me of organizing, and that's writing a little standardized first thing in the morning of who's got lines, who's got this going, who's got this going, and so I have that snap sheet right in front of me with each day, and then with each room, things that need to be done that pops up when these orders pop up all day long, changes. So you have to have some sort of organization system. Yeah.
Absolutely. I've seen some nurses actually color code it with like before lunch, during lunch, and after lunch for those that are working day shift. And then other nurses can just work directly from the computer screen. I'm not that good. I have to have something tangible in my hands for that. Miss Tiffany, what do you have to add?
Everything is so different in the operating room. I mean, honestly, it's different. Like as far as organization for us, I mean, we could have one big case all day long, but those are actually more stressful than having a lot of small cases because that one big case, you have multiple setups in the room, like so much equipment, way too many bodies in a small room, just trying to organize who's in and out of the room and who touched what, and what the specimens are, and it gets very hectic at times. But as far as organization, it's mostly just equipment and things to position the patient, because I'm kind of a bulldog about positioning my patient, because a lot of times they're laying there and can't move for hours and hours and hours, and I have been known to scream at a doctor if they're rushing me through positioning my patient, because it's important. They have to, you got to make sure everything's right. Everything's just different in the operating room.
So what is the most important thing that you take to work with you each day? What's the one thing you're lost without?
Compassion. For
Passion.
me, you can't lose that compassion.
Absolutely. These are real people that you're working on, and that this is one of the worst days of their life, whereas it's just another day of work for you. So very, very important. Miss Jodie, what about you?
I just love what Tiffany said, because that is so true. You cannot forget that. I don't have, like I said, I don't have a mundane day ever. And I'm not saying that surgery does. That's not what I mean. But with the activities of constant things being buzzed in your ear, families, needs, telephone calls, you know, all day long, lab orders, medicine changes and stuff. You can't just be the nurse of task. You have to be the nurse of, hey, how you doing? What can I do for you? You know, because even your most calm patients, this is probably one of the worst days ever. And I love that she said that. As far as tools go, of course, I need my stethoscope and my clipboard and my pen. And my little pen pouch also has, you know, a little light to check the eyes, and things like that are also extremely important to have on hand for us.
Okay, so wrapping up, what is your one piece of advice to new nurses who are now where you were a year ago?
You have to grow a backbone, but it's worth it. It's people, when they say nurses eat their young, I've seen it. It does happen. You have to grow a backbone, but it is so, just don't forget why you went into this field. It's extremely important to remember that those patients need you, and it's worth it. It really is worth it. It's going to be extremely hard, but it's worth it.
And every day you grow. And
Absolutely. And every day you're going to learn.
You grow, you learn something new every day. Yes.
Absolutely.
Yeah.
And I like what you said, Jodie, about asking questions. One thing that I've learned through the years is the new nurses that are most scary to me are those that walk out and are like, oh, I got this, because they're not asking the questions, and that it ends up biting them every time. What's your piece of advice, Jodie?
Your fellow workers are stressed, just as stressed as you are, you know, and your nurses, your doctors, your lab tech, the imaging people that come to take your patients, everybody's got a time schedule and they're stressed. So when somebody is grumpy towards you, or maybe what comes off as a grumpy response, like Tiffany said, you kind of got to grow a backbone, because really, unless it's just an unusual employee, even though that moment may have sounded grumpy, we're all in this together, and they know that, and you've got to know that. You can't take it personally. You just grow strength from it. Know that all we're doing is trying to do what's best for the patient and make sure that they get things in a timely manner.
Absolutely.
Something to add to that is don't get too big for your britches, because you might have that RN behind your name and you might think that you know more than that CNA in the room with you, but you don't, because that CNA has been there. She knows, he knows. Listen to them, because a lot of times the biggest, most important things that you're going to learn come from somebody who don't have the credentials that you do.
Oh my goodness, yes.
Take care of your techs and your CNAs.
Your CNAs are wonderful, wonderful people.
And your CNAs are going to be the eyes and ears for you. They're seeing things through their different role that you as a nurse may miss. And that can mean the difference in illness and staying in the hospital another week versus being able to get your patient in and out and discharged. So absolutely.
Don't ever let the words, I'm not going to do that, that's the CNA's job, come out of your mouth.
Need to be partners with your CNAs and help each other, because once your CNA recognizes that you're the nurse that's going to be on the patient's side and is going to be on their side, they will do anything in the world to help you and keep your patients safe. So, and that's the most important thing that you can do. Absolutely. Do you guys have anything to add?
Good luck, everybody.
This is the best time. I wouldn't go back to school even as hard as this first year has been. So enjoy. Yeah, this is best time.
Take a break, just a small break, I don't know, a couple weeks between graduation and before testing for your NCLEX, and don't do anything. Spend time with family, get back, learn who you are again, and then start studying again, but you need to take that break.
Absolutely. Jodie, do you have any last words?
Same as Tiffany, take that little break.
Very good.
Go to the beach. That's what we did.
That's right, we did.
Okay. Thank you guys for listening. Have a great day.